it's recording it. Okay, it's recording. Okay, so welcome everyone. I'm just gonna go over these rules before we begin. Thank you all for joining. Hold on, I see more people trying to get in. Okay, thank you all for joining. Please be respectful of everyone during the study session. Please mute your mic while the content review session is taking place. Ask questions and participate. There's no stupid question. This is a judge-free zone. Please keep the questions related to the subject topic of the day. And if you haven't yet, please subscribe to my YouTube channel. I plan to do free study sessions like this regularly, and I appreciate all you guys' support. Also, so as I'm explaining the different topics, if you have a question, I can't see the chat unless I click off. So I guess you guys can police yourself, and let's say you have a question, just turn off your mic and ask the question while I'm going through it. This way I don't have to click off and go back. And if you hear someone else talking while you're talking, just wait until they're finished, and then you can ask your question, okay? All right, so let's begin. So the id, the ego, and the superego. So before I start, what do you guys know about these three forms of consciousness? What do you guys know about it so far? If you don't know anything, you can say nothing.
The id is the pleasure principle.
Uh-huh. Okay, yeah, good, good. Anyone else want to take a crack at it?
It's the psychoanalytic theory.
Yeah, right? Part of the psychoanalytic theory, right? So the id, the ego, and the superego are a set of three concepts in the psychoanalytic theory. So the id. So the id is the most primitive part of our personality. It represents our animalistic urges for those things like desire, for the desire of food and sex. And the id seeks instant gratification of our wants and needs. So when you think of the id, think of instant gratification. Also, the way I like to remember all of them is the id is like the devil, right? The superego is like the angel, and we are the ego is the person in the middle. So the superego, it's the part that develops last and is based on moral judgments about what is right and what is wrong. And the superego strives for moral perfection without taking reality into account. And then when we go to the ego is a decision-making part of the mind. It uses reason and logic and tries to come up with the most realistic solution. So let me give you guys an example of how to remember all three. So you guys are studying for your LMSW exam, right? So let's say one of your friends called you up and was like, hey, let's go to a party. So the id will say, okay, close your laptop, close your book, we out to the party. The superego will say, we cannot study. I mean, we cannot go to that party. We need to study. I don't care if we've been studying all day, we need to study. So the ego will say, okay, if we study for 3 hours, then we can go to the party, right? It kind of, the ego is the one that's making a decision and weighing out both perspectives from the id and the superego, right? And the way the ego deals with it, that's called ego strengths. So the ego's ability to effectively deal with the demands of the id, the superego, and the reality. So was that all clear to you guys?
Yes.
Yes? Okay, good, good, good. So question, what is the level of awareness where you're not aware of the information, but it could easily enter your consciousness? So I want you guys to type it in the chat. What is the answer? So what do you guys think? Don't be shy. Okay, I see preconscious, unconscious. The subconscious, I see C. B. All right, so the correct answer here is C, right? So I'm gonna explain what each of those level of consciousness is on the next slide. So what you should know about the psychoanalytic theory and Freud. So Freud believed that personality solidifies during childhood, largely before the age of 5. The psychoanalytic theory sees clients as a product of their past, and there are 3 levels of awareness in a psychoanalytic theory: consciousness, pre-conscious, and unconscious. So consciousness, that's what we are aware of right now. So that is what we're aware of right now. The pre-consciousness is the information that can be put into our consciousness, but we are not aware of it. And then the unconscious, that is the part where it's very, very hard to move it from the unconscious to the conscious. So the pre-conscious is the part that we are not actively aware of it, but it can easily become aware to us, right? It can easily move to the conscious. The unconscious, that's the part that it can be moved, but it's very, very hard and not likely that the information in our unconscious will move to our conscious. Was that clear to everyone? Did that make sense? Yes? Okay, cool. Next. So what stage in Freud's psychosexual stages of development does the Electro Complex take place? So what do you guys think? What stage is that? So is it A, B, C, or D? It's okay. You're going to learn it today. It's okay if you don't know it. It's okay. B, I'm guessing. It's okay. I see some A's. I see some B's. All right. So the correct answer here is D, phylax stage. So here are the psychosexual stages of development. So I'm going to go over each one. So the first stage is oral. That's from birth to 1. And then the pleasure zone is the mouth. So let's say you have a practice question. If it says anything about the mouth, let's say you binge eating disorder, smoking, thumb sucking, you know that that's going to be, the oral is going to be the correct answer. Now, when we go to anal, anal is from ages 1 to 3, and it deals with the anus. And then during this stage, children begin to potty train. So if you see a question that has to do with bowel movement, something around those, and something around that area, you know it's going to be anal. So the phylax stage, that's from ages from 3 to 6, and it deals with the child's genitalia. And then during this age, that's where the Electra and Oedipus complex come in place. Does anyone know what that is? Have you ever heard of that before? No? All right, so the Electra and the Oedipus complex. So basically what happens in this stage is that the child wants the affection of the opposite sex parent. So they think they're in competition with the same sex parent. So a daughter, she wants her father's love. So she thinks she's in competition with her mother. The son, he wants his mother's love. So he's in competition with his father. So that's the Electra and the Oedipus complex. So that happens during the phylax stage. Then latency stage, that's from ages 6 to 12. And during this stage, that's when dormant or repressed sexual urges happen, and children begin to spend more time interacting with peers of the same sex. And then during the genital stage, that's from age 12 to death. And that's where children have active sexual interest, and they become attracted to the opposite sex. Does anyone have any questions before I move on? Yes, what question? Or is that a yes from before? Any questions? Was that all clear? It's no problem. I'm trying to break everything down as easy as it can be, so this way everyone can pass their test and be on their merry way. Nobody wants to have to sit and take that test again or pay that money. So another question. So Anne is a 40-year-old woman who suffers from binge eating disorder. What stage might Freud say she's fixated on or stuck at? So what do you guys think? So I see B, 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 and I see someone said, I just learned phylax stage as genital equals pleasure zone. So all of them have their own pleasure zone. So for oral, it will be like the mouth. For the anus, it will be, for anal, it will be the anus. So they all have a pleasure zone. So I see B, 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 B. And yes, the correct answer is B, oral, right? They have a binge eating disorder that has to do with the mouth. So good. So Freud believed if certain issues are not resolved at the appropriate stage, fixation occurs. And until the conflict is resolved, the individual will remain stuck in a particular stage. So if you see questions and axes, you know, is this person stuck at this stage? You know that this is what Freud believed. And if people don't fix or they're able to resolve the problem at a certain stage, he believed that they were stuck there. And that's where all these problems develop in later in life, like people having smoking issues and all that. So here's an easy way to remember the order of it. So onions are purple, girl. So onions is for O, R for anal, purple is the phylac and latency, and G for genital. So this is the easy way. I always remember like the order. I just say that, I'm like, okay, this comes before that. So this is the easy way just to remember it. Okay, so we're going to move into the behaviorist theories. So who are the theories associated with operant conditioning? So what do you guys think? A, B, C, or D? I see A, I see A, I see C. A, D, see some C's. Okay, make sure we're good on time. No, it's A. Okay, so the correct answer here is actually D. So Skinner was a part of operant conditioning. Pavlov is a part of classical conditioning. So the correct answer is D, Skinner and Thorndike. For the exam, I've never ever seen a question problem with Thorndike, like explaining what he did. He did an experiment with cats, but you don't really need to know that. Just know that both of them are associated with operant conditioning. And sometimes they call operant conditioning instrumental conditioning. So just know that. That's all you really need to know. So true or false, what do you guys think? Can punishment be positive or negative? I see true, 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 true. True, good. All right. So definitely it can be positive or negative. So operant conditioning was coined by the behavioral theorist B.F. Skinner. Operant conditioning is a method of learning that employs rewards and punishment for behavior. Through operant conditioning, an association or pairing is made between behavior and a consequence for that behavior. So this is how I want you guys to remember it, to make it as easy as possible. So positive, think that they're adding something. If you see negative, that means something is being taken away. If it's reinforcement, that means they want to encourage a behavior. And if it's punishment, that means they want to stop a behavior. So when you're looking at the questions, you want to see first, was something given or was something taken away? That will help you narrow it down to remove two of the answers right away, because it's either going to say positive punishment or negative punishment and go like that. So if you know it says positive, if you know they added something, it's going to be a positive. So you know that anything that had negative is going to be wrong. And then the way you want to see is that, do they want to reinforce that behavior? Do they want to encourage that behavior? So if they want to encourage that behavior, that is reinforcement. If they want to stop that behavior, that is punishment. So I have a problem for you guys. So which of the following would be considered negative reinforcement? So what do you guys think? I see some B's, I see some A's, I see some A's, some B's. Okay, what do the rest of you guys think? What do you guys think? The A's. Okay, good. So the correct answer here is A, right? So let's go through each each answer and let's see what it is, right? So anytime for A, anytime your child gets an A on a quiz, they do not have to do the dishes for a week. So here, was something added or was something taken away? It was taken away, right? So do we want to encourage this behavior or do we not want them to do this behavior? Encourage, right? So definitely, so that's why it's negative reinforcement. Let's see B. Taking away your child's car keys when they fail a test. So what is this? What is B? I see positive punishment. What do the rest of you guys think? Is B positive punishment? I see negative punishment. What do the rest of you guys think? Negative punishment. Negative punishment. So yeah, so B is negative punishment because they took away the keys. So they're taking away something and they don't want them to continue to fail the test. So that's why they're taking it away. So B is negative punishment. What about C? Giving your child the car keys when they get an 8 on a test. What is that? I see taking away something desirable for B. So C is positive reinforcement. Yes, good. So for question B, it's negative punishment because they took away something. So that was they took away the car keys when the person fails a test. So they don't want them to continue to fail the test. So this was punishment because they failed something. So they took away keys because they failed the test and they don't want them to continue to fail that test. So this B would be considered negative punishment. C is positive reinforcement. So what would D be? Assigning a child extra chores when they fail a test. What would that be? What would D be? I see positive punishment, positive punishment. Yes. So D would be positive punishment because they added the chores because they failed the test and they don't want them to continue that behavior. So is that clear for everyone? Was that breakdown clear in terms of positive and negative reinforcement and punishment? Yes? Okay, good. Okay, we have another poll question. So what theorist is known as the father of classical conditioning? So everyone should get this answer correct. Who was that? D. Good. So I see a whole bunch of Ds. Good job. So yes, Pavlov the dog. Yes, Pavlov. So classical conditioning, Pavlov the dog. So classical conditioning was coined by Ivan Pavlov. Classical conditioning is a type of conditioning learning which occurs because of a subject's instinctive response. So Pavlov, right, the dog was salivating every time he heard the bell because he knew he was going to get the meat. So during classical conditioning, there are 3 phases. So it's the acquisition phase, the extinction phase, and the spontaneous recovery stage. So here I just put what the abbreviations mean. So in the acquisition phase, this is when you pair the conditioned stimuli with the unconditioned stimuli, and that produces a conditioned response. During the extinction phase, that's when the unconditioned stimulus does not occur after a conditioned stimulus is present over time. So extinct, think of the name extinction. And spontaneous recovery is when a conditioned response reemerges after a long break. So, whole question. The gradual disappearance of a conditioned response is a result of presentation of a conditional stimuli alone is referred to as what? So what do you guys think? I see A. I see A. What do the rest of you guys think? What do you guys think? What is the answer? I see a couple A's. Yolanda put a question mark. What is the question mark for? I see A. Guessing A. Okay, the correct answer is A. So this question, I know it seems hard, but all it's asking you is when the conditioned response stops, like when it continues to disappear, what is that called? So that's just called classical extinction. That's it. It's extinct. It's becoming extinct. So that's all this question is saying. I know it sounded harder than it is, but that's all it was asking. So the people that guessed A, you were correct. Okay, so Piaget. So Piaget operational stages ends at what state? At what age? So when does the pre-operational stage end? I see some D's. I see C. I see A, D. Okay, so the correct answer here, so this is saying when does it end? The correct answer is C, pre-operational stages from 2 to 7. All right, so let's go over Jean Piaget. So Piaget believed that people of all ages develop intellectually. He assumed children build their knowledge based on personal experience. They learn things on their own without influence, and they are motivated to learn by nature, not by rewards. So he didn't believe in the behavioral theorists that people need rewards to do something or punishment to do something. He believed that they wanted to learn. It was instinctively. It was by nature that they wanted to learn. So how many stages are there in Piaget's stages of cognitive development? What do you guys think? I see C. C, someone put 4. C, B. Okay, good. So there are 4, right? Let's go over the first one. So the first one, so sensory motor. So the ages are birth to 18 to 24 months. And the main goal at this stage is establishing an understanding of object permanence. So that's understanding that an object can still exist, you can't see it, right? So that's why you have babies, when you put something in front of them and you move, they look so surprised, they're like, wow. And then you bring it back, they're like, what? How did you do that, right? So that's sensory motor stage. Next is pre-operational. So that's from ages 2 to 7. Children at this age are egocentric, meaning that they have difficulty thinking outside of their own viewpoint. The main goal of the stage is being able to attach meaning to objects with language, and conservation of mass and length occur around age 7. Then we have concrete operational. So that's ages 7 to 11. Children are less egocentric. The conservation of weight happens around age 9. The conservation of volume happens around age 11. And the main goal at this stage is for children to start working things out inside their head. That term is called operational thought. But at this stage, they are not yet able to abstractly think, right? They can do simple things, probably understanding like simple math, but they can't abstractly think yet. And then during formal operational stage, that's from ages 11 and up, children are capable of abstract logic and reasoning. And Piaget believed that once a person reaches formal operational stage, it's more about building upon the knowledge, not changing how it's acquired or understood. Okay, so this is an easy way to remember the order. So some people can't fight. So some is sensory motor, so S. People, P, operational, can't, concrete operational, and fight, formal operational. Is everyone okay? Everyone good? Was that clear? Yes? Okay, good. Okay, now we're going to get into some practice problems. So poll question, which of the following is the most accurate about people who faced abuse or neglect? So what do you guys think? I see A, I see C. What do you guys think? What do the rest of you guys think? What's the correct answer? I see C, C, C. Does anyone want to explain how they got their answer or why they picked their answer? Okay, so the correct answer here is C, right? So just because someone faces abuse or neglect, it doesn't mean that they're automatically going to develop PTSD. It also doesn't mean that they can't form lasting relationships. There are so many things that come into play when it comes to people who face abuse and neglect. A big important factor is the person's support system that can help and that can, kind of lessen the effects of the abuse and neglect. But you can't always say that just because they went through this, they're going to have this. And then they all have chronic stress issues. That's not true. So the correct answer is that they may be at greater risk of developing psychological problems. So that is true. They may be at a greater risk, but that doesn't automatically mean that they're going to get it. All right, next question. A social worker has been asked to assist an elderly client in moving. In the initial interview, the client repeatedly attempts to discuss past experiences. What is the social worker's most appropriate response to the client? I'm guessing. I mean, you have to do what you've got to do. Sometimes you got to guess, right? What do you guys think? I see B, B. I see B. B, B. Oh, everyone's picking B. Okay. Okay, so good. So the correct answer is B, right? So one thing I always say is you can remember these three things. Answering the client intervention and assessment problems will be a lot easier. So the first thing you always want to do is check for safety. After that, you want to acknowledge and validate the client's feelings, and then you want to assess the situation. After you assess the situation, it can vary. You might have to refer them out. You might have to educate them on something. It can all vary. But I think understanding those three in the order that they come in will make answering the intervention questions easier. So for this one, yes, facilitate discussion of the recollection. You wouldn't just want to ignore him. That's really rude. And you wouldn't just want to do that. Refer the client to psychiatric evaluation. Him just speaking about, his past doesn't mean he has some kind of psychiatric disorder. He's an elderly person. Maybe you're one of the first people that he's talking to in a while. So, and then conduct a biopsychosocial, not so much. He's just speaking about his past. You guys are, he's getting ready to move. So maybe he just wants to start conversation with you. So yeah, the answer would be B. So good job. Okay, so what kind of role modeling is used when a client uses their imagination to visualize a particular behavior? What do you guys think? Okay, I see a C. Okay, what do you guys think? I see C. See B. Okay, so we pick C and B. All right, so the correct answer is C. So good, covert modeling. So does anyone know what participant modeling is? Can anyone explain that? What is that? No one? Have you guys ever heard of participant modeling? No? Okay. So participant modeling is when the social worker participates in the modeling and they're the one that's going to demonstrate the behavior. And then after they demonstrate the behavior, they're going to ask the client to do the same behavior. So that's participant modeling. And then introvert modeling, that's fake. I made that up. That's not real. And then live modeling, that will be when the social worker will, let's say they want the client to engage in, like, to let's say they want them to learn how to speak to people in public. So the social worker might take the client to the mall and let him or her see the person, different people speaking live. And then after he sees someone doing it, then he's going to tell them, okay, I want you to do that same behavior. That's live modeling. So yeah, good job. The people that picked it, good. Okay, next question. So in a community center, a social worker is approached by an angry client. The client is upset and is making a scene in the building. How should the social worker handle the situation? So what do you guys think? I see some B's, I see some B's, I see more B's. B. Good. So excellent, excellent, excellent. So yes, definitely, right? So if a client comes into your office and they are very angry, right? You wouldn't want to dismiss them. You wouldn't want to just call your supervisor. You definitely, calling the police is kind of extreme. You would definitely want to listen to what the client has to say and then assess the situation from there. Now, if they become violent, may start attacking you, then you might have to call the police. But you shouldn't want to do that right off the bat. So good job. Everyone said B. So next. So what technique is used by social workers to restate what the client says in order to join information together? So what is that called? I see B. I see A. I see A. I see D. See a couple D's. Okay. So yes. So the correct answer here is D. So paraphrasing. So paraphrasing, this is actually the definition of paraphrasing, when you restate what the client says and then join information together. That's paraphrasing. I'm not going to tell you what the meaning of reframing is because there's a question on there. So I want to get to the question before I explain the definition of all of them. So good job for the people that picked D. So what does SOAP stand for? Yes, this video is recorded, so you can come back and watch it. It's all good. So I see A, I see C, I see C, see B. Good. All right, the correct answer is C. So this is just definitely something you just want to memorize. They might ask you a question, might ask you what it is, and they might try to trick you like this. So just make sure you know what that means. So subjective, objective, assessment, and plan. So good. So when you state a problem differently so a client can see a different perspective or other possible solution, this is called what? So what is this called? So I see A. Okay, so good. The correct answer is A. So this is reframing. So when you say something to kind of show a different perspective or shine a different light on how they may be viewing a certain problem or situation. So good. So joining is not a real thing. Clarifying is might restate the question, or you might ask in a way just to make sure that you're on the same page as the client. So yeah, good job. You guys all picked A. Good. So next, so Michelle is a social worker who recently lost her job due to COVID. After losing her job, she decides to visit her parents for a week. While being in her parents' home, she wears her old nightgown and watches cartoons all day. What defense mechanism is Michelle displaying? So what is the answer? So I see D, D, D. See a whole bunch of D's. Okay, good. Can anyone tell me what these defense mechanism means? What's projection? What is projection? So yeah, the correct answer is D, regression. What's projection? What is that?
Like you're putting your feelings on that person.
Mm-hmm. Good, definitely, right? So think of a projector, right? It's coming from inside and coming out. So that's projection. What is displacement? What I know this. I don't think displacement's here, but what is displacement?
I believe it's taking out like your anger on like somebody else, like taking out your feelings on somebody else, but it's like not meant for them.
Yes, good. Excellent, right? So displacement would be like this. Let's say you work at a job and your boss gets you really upset, right? So you're angry. Then you go home and you place those feelings onto your children, right? So usually with displacement, you place those feelings on someone that has lesser authority. So you know you can't go and scream at your boss because you get fired. So you go home and you either start being mean to your wife or being mean to your husband or being mean to your children. So that's displacement. So good. Okay, so next question. The two most common defense uses by couples with marital problems are what? What do you guys think? So I see C. I see D, C. Yes, so good. So the correct answer here is C. So this is just something you should just memorize if they ask you a question like this about marital counseling or marital problems. Which one? It's usually projection and displacement, right? Because think about it. Usually people are upset with themselves or upset because something internal, then they project it out onto their spouse, and then also displacing feelings. So like they can be upset because of work, and then they come home and displace those feelings onto their partner. So very good. Okay, next. So these questions are a little tricky. So what biological system creates hormones like insulin in the body? So you may get questions like this. I've actually seen one, about the biological systems. So what is the correct answer? I see a whole bunch of C's. I see D. C. So good. The correct answer is C, the endocrine system. So the endocrine system, that's the system that deals with hormones like insulin, glucagon, that are created in the pancreas. Also deals with the parathyroid hormone, just this whole big system that helps us function, right? So you don't need to know in depth like that, but just understanding what the endocrine system is, the nervous system that deals with our brain, our spinal cord, the cardiovascular system that deals with our heart, and the lymphatic system that deals with fat drainage, and also it deals with our immune system. So if you see a question on the immune system, the lymphatic system plays a big role with the immune system. Endocrine system deals with hormones. The nervous system deals with our brain. And then the cardiovascular system, that's our heart. So good job. So what is the main difference between HIV and AIDS? I see a whole bunch of A's. Okay. Excellent, excellent, excellent. Yeah, so HIV is the virus and AIDS is the illness. So good job. You guys are doing so well. Wow. Does anyone have any questions before I move on? I think there are a couple questions left. Does anyone have any questions before I move on? No questions? Okay. So having which of the following results will be more harmful to a patient's treatment plan? So which of the following will be more harmful to a patient's treatment plan? So is it a type 1 error, a type 2 error, type 3, or type 4? This one's a tricky question. So I see B, A. Okay, I see B and A. So can anyone tell me what a type 1 and type 2 errors are? What is which? Like, can you tell me what's a type 1 error and what's a type 2 error? I see B's, okay, and I see A's. So does anyone know the difference between the two? Guessing, don't know. It's okay. I'm going to explain both of them. Never heard of it, really. Usually you learn in your research social work class. But okay, so the correct answer here is type 2 error. So a type 2 error is a false negative error. So if you have a false negative, that can be very dangerous, right? So that means you're saying something is negative when it's positive, so you're not catching whatever you're looking for. So let's say you have a client who may be having headaches, and they go to see you, they tell you that they have a headache, so you refer them to a physician. They tell the physician that they have major headaches, they do a PET scan, and they say there's nothing there, but there really is something there. They have a tumor in their brain, right? So now you're saying that there's nothing there. So this person think like, I'm good, there's nothing there. And now they have a tumor, a brain tumor that they don't know about. And you're trying to treat them. They're coming into you telling you, that they're having headaches, maybe they're having bodily pain, that they're extremely fatigued, that they don't want to do anything. And sometimes with brain tumors, that can affect someone's personality. So if they have something like, let's say, in the frontal lobe of someone's brain, that is where our personality forms, in the frontal lobe. So let's say they have a tumor there and they're having pressure on that part. What if their personality changes? What if they start becoming very, very depressed because of that? Or they start having depression symptoms because of that, right? So if you have a false negative, it can be very, very dangerous because you're not catching something that's there. Now, if you have a false positive, that it's not so much dangerous, but it can be more expensive and also scare you, right? It can scare a patient. So if you have false positive, you tell someone they have cancer when they don't have cancer and they start chemo and all these things, right? They're lucky that they don't have it, but let's say they don't have insurance or something like that. See, it becomes very, very expensive. So out of the two, false negative can be very dangerous because you're not catching something that's there. A type 3 and a type 4 error, you don't need to know about that. That's nothing that in social work we really mess with or we really need to know about. If I'm not mistaken, a type 3 error is when you catch, I think, a false negative, but you catch it for the wrong, or no, you catch a false positive, but for the wrong reason. And I don't really remember what a type 4 error is, but we don't really need to know that. You just need to make sure you know a false positive and a false negative. So false positive, that's a type 1 error. A false negative is a type 2 error. Was that clear for everyone? Did you understand why that was the correct answer? Was it clear? Was it not clear? Are you guys confused? Clear? Good.
I was confused.
Okay, so what part were you confused about?
What part is type 1? So you go to the doctor, you
Okay.
get a negative, but it would be a false negative, but it's actually positive.
Yes.
So is that type 1 or is that type 2?
That's type 2.
Okay.
Yes, a false negative, right? You have a false negative, but you really have a positive result. So that can be very, very dangerous because you're telling them that they don't have something that they actually do. And if it's something like cancer, right, we want to catch that first, when it first happens, not wait until the symptom they get to stage 3 or stage 4 where it's really hard to treat. So yeah, false negative. So false negative is when they say that something is not there when it actually is. False positive is saying that something is there when it isn't present.
Okay, so that's type 1. Thank you very much.
Yep, no problem. And that's all I have. So do you guys have any questions for me before we end? Was this helpful? Did I explain it well? Was it easy to follow? Yes. So this week I'm really busy, but I'm going to try to do another one next week. When is my next class? Yes, it's no problem. Yeah, I'm definitely going to do it, not this week, but next week. I'll probably do another one and I'll post it in the, let me stop recording.